So, the Paris hospitals became a place of research and learning. These new hospitals also had large dissection wards. Again, French citizens felt it was their patriotic duty to donate their bodies to the furtherance of science and medicine, and the decline of religious authority cleared the way for this new way of thinking. In fact, many patients agreed to allow their dead bodies to be displayed to the public for educational purposes. It was quite a popular attraction in early 19th century Paris to go and look at the dead bodies. But more important to our story is that the overflowing morgues in these new hospitals offered plenty of cadavers for the medical students and scientists in Paris. In fact, each student could have a cadaver of his own to experiment on and to learn the physiology of the body firsthand. So, as we've said, the hospitals of Paris are very important to this story. The unprecedented access to human bodies and cadavers was made possible by the large hospitals of Paris, like the Hôtel Dieu, that had once been a warehouse of death, but had now been transformed into an efficient and organized hospital with wards of learning. The Hôtel Dieu in central Paris is enormous. In 1800, it had 4,000 beds. Now remember, under the new system, there was one occupant per bed, and the beds were grouped into wards based upon disease and symptoms. Contrast this to London, which in 1800 was the largest city in the world. It only had 200 hospital beds. Or to the United States, which in 1800 in the entire nation had not a single hospital bed. In contrast to Paris, medical training in the United States and England consisted of following a local doctor, who may not have even had a medical degree, around for a few years. That was it. It was a master apprentice based system that was highly varied, with your level of education and preparation being totally dependent upon the guy you were following around. In Paris, the Faculty of Medicine was staffed by full-time professors who were appointed by competitive examination that were administered by the state of France. The appeal of being taught by a professional physician in a large organized hospital with plenty of bodies to experiment on is obvious, especially compared to the alternative of shadowing the local quack for a few years. So, we've established that in Paris, medical students and scientists in general had unprecedented access to human bodies, live bodies that were sorted by symptom and ailments, and dead bodies that were ready to be dissected. These factors led to several revolutionary discoveries. I want to talk about two of these very important discoveries that you would recognize in use still to this day, and that is the birth of tissue pathology and the clinical trial. First, let's discuss the birth of tissue pathology, or histology. In 1801, a man named Bichat wrote a book called General Anatomy Applied to Physiology and Medicine. In this book, Bichat postulated that the body was made up not of four basic humors, but of 21 different textures. He believed that these textures were independent and elemental units of the human body, and that their derangement is what caused disease. He claimed that deranged textures, or what we would call damaged tissue, formed lesions in the body that resulted in disease. He verified the existence of these lesions upon post-mortem autopsy. In 1806, a professor of medicine in Paris named Corvisart expanded upon the ideas of Bichat. Corvisart, who was the private physician of Emperor Napoleon I, showed a connection between symptoms, disease pathology, and lesions. For example, if a person overexerts himself, has chest pain, and then faints away into death, Upon postmortem autopsy, you'll find some sort of lesion in the person's heart or in the arteries and veins surrounding the heart. This is a heart attack. The symptoms, the disease, and the damaged coronary tissues or lesions are all connected. As simple as it sounds, this is the birth of understanding the cause of death based upon tissue pathology. A more in-depth example of tissue pathology is provided by the physician René Laennec. In 1819, Laennec wrote a book called On Mediate Auscultation that described his invention and use of the first stethoscope. What was important about this research was that Laennec proved that the disease that was occurring on the inside of the body could be diagnosed from the exterior of the body. In other words, Laennec used his stethoscope to listen to the lungs of his patients, and he noticed and named very specific types of sounds. After the patients died, he dissected the patients and noticed that very specific sounds that he had heard through his stethoscope and named corresponded to very specific lesions or morbidities in the pulmonary tissue. He learned to differentiate between the sound of liquid in the lungs, pneumonia, as opposed to hollow cavities in the lungs, tuberculosis. These discoveries were very important in discovering that specific diseases resulted in specific tissue damage. This helped physicians to name and differentiate one disease from another. The second important discovery of the Paris School of Medicine is the clinical trial. Beginning in the 1820s, a physician named Pierre Louis began doing experiments on the efficacy of bloodletting in cases of fever. He wondered several things. Does it matter when you let a patient's blood? Does it matter the days you do it? Do patients who are bled early versus being bled later in their disease fare better or worse? So to answer these questions, Pierre Louis gathered 77 patients at the Hôtel Dieu who had fevers caused by pneumonia. Now remember, thanks to Laennec, we can diagnose pneumonia and distinguish it from tuberculosis. Upon these 77 patients, Pierre Louis conducted experiments. Some of the 77 patients were bled early, some were bled later, and some were not bled at all. The results of the trial showed that there was not really a whole lot of difference in any of the groups. Of course, this raised the ultimate question. Does bleeding even do anything beneficial for the patient? Within 5 years of this simple experiment's publication, bloodletting, which had been the cornerstone of medicine for over 2,000 years, faded away and never returned. So the takeaways from the Paris School of Medicine are the reorganization and birth of the large hospital, the use of bodies, both alive and dead, for clinical research, the observation, touching, and talking to the patient, or what we would call clinical medicine, the birth of tissue pathology, and the birth of clinical trials. Now, it's important to note that although doctors were learning to diagnose accurately, there were almost no new therapies to cure patients. Now, in the next module, Module 3, we're going to talk about 19th century beliefs regarding disease etiology, or the cause of disease, how diseases spread. And we're going to start talking about the first major outbreak of cholera in the 19th century.